Honorable Ministers of Health, distinguished audience, His Excellency Mr. Adawi apologizes for not being able to attend, and he extends his regards and appreciation for being invited to this important meeting in this beautiful city. He also wants to thank the WHO and the World Hepatitis Alliance for taking this initiative to bring together such a global event for the first time. Hepatitis C was spread in Egypt during the 60s and 70s of the last century because of mass treatment for schistosomiasis or bilharziasis. And this created one of the largest spreads of a blood-borne disease anywhere in the world. The National Health Survey of 2008 showed that 10% of the surveyed population had hepatitis C virus. The prevalence in the same age group this year in the newer survey dropped to 7%, but still today between 7 and 8 million patients are living with hepatitis C in Egypt, which is a huge national problem and a huge national economic burden. The Ministry of Health established the National Committee for Control of Viral Hepatitis and a Consultant Committee for Prevention. And treatment efforts were able to treat around 350,000 patients with interferon-based therapy during the past 7 years, but with cure rates of slightly less than 50%. With the availability of new effective direct antivirals, it became a top priority or a top national priority to make available the best approved treatments at affordable prices and to increase patient access to treatment. We were able to negotiate with Gilead last year, and we thank Gilead for their agreement to provide Sovaldi to the Egyptian market at a low fraction of the international price, which made it available to provide therapy for free to almost all patients. And other manufacturers of hepatitis C treatment have followed the same suit. Our major problem was to organize patients to start being evaluated for new treatments. And to organize patients for access to treatment, we created a web portal where patients registered online to take appointments to be evaluated. And this approach proved very successful. 200,000 patients registered online in the first 3 days. And the number of patients registered increased above 1,100,000 this last July. More than 130,000 patients have started receiving treatment with cure rates above 85% for patients with liver cirrhosis who we started treating earlier. And we are targeting to treat 350,000 patients next year and more in the following years. Taking treatment efforts further, the Ministry of Health is planning a pilot viral hepatitis elimination model in the state of Aswan in the south of Egypt, where the entire population will be screened and all infected patients will be treated, and in an effort to totally eliminate hepatitis C from this state, to see whether this will impact transmission of disease further or not. Last October, we launched the National Plan of Action for the Prevention, Care and Treatment of Viral Hepatitis in the next 5 years. And we acknowledge that unfortunately there are still close to 100,000 new cases of hepatitis C each year in Egypt. And prevention is a top priority in the plan of action going forward. The action plan has 7 pillars. Number 1 comes blood safety measures, infection control measures and safe injection, education and raising awareness of healthcare providers and communities to prevent infection, vaccination for hepatitis B, promoting surveillance and case finding for hepatitis C, care and treatment for as many patients as we can, and research. The Ministry of Health is also collaborating with the WHO, US CDC, and national media campaigns for public education and awareness. Other than hepatitis C, in addition, there are close to 2 million cases of hepatitis B infections in Egypt, which is a prevalence of around 2%. Hepatitis B vaccination is part of an extended program of immunization since '92. And in a recent study, the prevalence in 20,000 screened 18 to 22-year-olds was less than 0.2%, which is more than 90% reduction in prevalence in this age group. Last July, the WHO hosted the celebration of the World Hepatitis Day in Cairo in acknowledgement of Egypt's successful efforts in confronting the disease, where we launched the injection safety program. And finally, the ambitious goal of eliminating viral hepatitis will require quick-paced and effective changes, further mobilization of resources, and continued political support. We have started implementing all three, and we hope to have a hepatitis C-free Egypt in the near future. Finally, I would like to extend His Excellencies and my personal thanks to the organizers and wish you all an enjoyable and fruitful meeting. Thank you very much.